Hello, everybody. I'm Syed Mohammod Minhaz Hossain, Associate Professor, Department of Computer Science and Engineering, Premier University. My presentation topic is predicting depression level based on human activities and feelings, a fuzzy logic-based analysis. And first of all, background. Global impact of depression. And 264 million people worldwide are affected over depression, and it is the information of World Health Organization 2023, and it's also one of the leading cause of disability and a significant contributor to the global disease burden and high prevalence among individual aging 15 to 29, and one of the second leading cause of death in this group is suicide. Consequences of the untreated depression. First of all, there are so many negative effects on mental health, economy, education, and it has a risk of suicide and chronic stress, and also loss of productivity and increased healthcare cost, and also diminish the academic performance and increase the dropout rates. And current challenges in the early detection is the stigma. Many individuals avoid seeking help due to the social and cultural taboos. And also depression is influenced by a mix of emotional, behavioral, and environmental factors. And also existing models often fail to adapt across diverse populations. Um, Limitations of the traditional approaches. And I think statistical models has lack of flexibility to account for ambiguity and the uncertainty. Deep learning models have high accuracy, however, require extensive levels of data sets and limited interpretability, as it is one kind of black box nature. And also social media-based prediction has dependence on user activity online, which may not reflected offline realities. And need for innovation solution. Key requirements: interpretability, models that healthcare providers and stakeholders can understand; adaptability, ability to handle the diverse and ambiguous data inputs; and efficiency, low computational cost is required for application in resource limited settings. Proposed approach: a fuzzy logic based model designed to predict depression levels, and it is focused on activities and feelings and combines the behavioral and emotional data and also incorporates the uncertainty. It handles the ambiguous and incomplete data sets effectively. First of all, significance of this study. Why fuzzy logic? It's one kind of mimics of human reasoning by categorizing the data into the degrees like poor, mediocre, and good, and effectively captures the notions of emotions and behaviors that traditional models overlook. And what is the objective of this study? First of all, develop an interpretable, robust, and efficient model for predicting the depression levels, and also provide a framework adaptable to diverse populations and applicable in real-world scenarios. Literature review, key studies, hybrid models like the OSBGC, LSTM. This is an amalgamate models and achieves high accuracy, but they are computationally expensive. Social media-based predictions has like interpretability, and fuzzy logic has shown promise in handling uncertainty and vagueness. And what is the research gap? First of all, lack of interpretable data-driven models integrating the activities and the emotional states. And another one is the limited focus on the local and cultural factors influencing the depression. Literature review. First of all, there are so many works have been done on depression. Like first of all, one work is the Ramesh and the Rakshmanna 2024 hybrid deep learning models, and it achieves high accuracy, 98%. However, it is extensively computationally also require resources, high resources. And social media analysis, and it is the Guntuku et al. 2017. It extracts the insights from user behavior, however, struggles with the variability in online expressions and lack of the offline applicability. And also there is another work, D. Suja et al. 2020, conducted in the 2020. It is also based on the fuzzy logic, but however demonstrate the potential in handling uncertainty, however requires domain-specific calibration for optimal results. So description of the comparison criteria, interpretability, accuracy, because interpretability is important because health wealth population need the models, how to ensure the trust and the actionable insights. And observation is the traditional machine learning has a medium interpretability, but lack of the full transparency. However, deep learning has low interpretability, high accuracy, however, operates at the black box. But social media based models, medium interpretability, and insights from the user data are somewhat understandable, however, lack of the depth. Our proposed model has high interpretability thanks to the fuzzy rules that mimic human reasoning, and accuracy. Accuracy is also important for the reliable predictions, especially in the sensitive areas like the mental health. And moderate accuracy is found in traditional machine learning algorithm. High accuracy is found in the deep learning algorithm. Social media based models has also moderate accuracy. However, our proposed model not only explain the interpretability, our insights also achieves high accuracy. Another one is the computational cost. It's also important because traditional machine learning has a low computational cost, deep learning has a high computational cost, social media models also medium computational. But however, as we know that as we utilize the fuzzy neural network, it is computationally low than other models. Real world usability. Model must work effectively across the diverse population and the conditions. And our proposed models robust against the diverse input and adaptable to the real world scenarios than the other models like the machine learning, traditional machine learning models, deep learning models, and the social media models. First of all, method and materials, data collection, survey via Google Forms, 30 questions focusing on the activities and the feelings, pre-tested with the 20 participants and finalized for the broader use, 545 responses collected and the pre-processed, feature collection, Pearson correlation and R-squared methods identify 15 key features from the 30 features, and model design fuzzy logic based inference model with 5 membership functions: poor, mediocre, average, decent, and good. And these are the 30 questions, including the gender, some activities questions, some feeling questions. There is a one question including both the activities and the feelings. It is suicide. And these are the 15 selected features from the Pearson correlation and the R-squared method. And model performance, accuracy, 94% evaluated performances, 50 participant, and it predicts correctly 47. And generalization, successfully it performs on unseen data, demonstrating the real world applicability. And also it outperformed the social media based approaches and the black box AI models. And what are the performance metrics? High precision in predicting depression severity levels like poor, mediocre, average, decent, good. And correlation inside strong features include the past trauma, suicidal attempt. And I think past trauma is a significant emotional predictor, and the suicidal attempt, the critical activity indicator. And also we do the ablation test, and including the all 15 features, 94% accuracy has been achieved. And when we only consider the activities, it achieves 86% accuracy. When we consider the only feelings, it achieves 82% accuracy. And comparative analysis, our model handles ambiguous inputs effectively using the fuzzy rules and also provides interpretable and the personalized predictions, and it achieves higher accuracy than the deep learning models in terms of the explainability and adaptability and robust performance with few features. And these are some examples. Considering some examples, rules 1, if do you have sleeping disturbance at night, disturbance at night is poor, and then depression type is also poor. And whenever we considering that disturbance at night is good and depression type is good. And real world implications. First of all, impact early detection and the intervention for depression. And also it is applicable in the low resource settings due to the computational cost. And in healthcare, education, and policy making, we can use our work. Discussion, what are the key findings? First, achieved high accuracy. Fuzzy logic effectively categorize the ambiguous emotional inputs, demonstrate the strong generalizability with the unseen data. Advantages is the low computational cost, high interpretability compared to the black box AI model. Challenges, a cultural specificity limits global applicability since we utilize only the Bangladeshi data. Also, section of the people in Chouet, Chittagong University of Engineering and Technology, and single time point data collection may not capture depression dynamics. Conclusion, it contributes to develop an interpretable and accurate model for depression prediction, and highlighted the importance of the integrating activities and feelings in mental health assessment. Future direction, we can expand our data set and incorporate the time series data for capturing the depression progression, and also can develop the applications like automated counseling, chatbot, and these are the references. Thank you.